and good afternoon, everybody. Um, Welcome to today's webinar for radiographers. I'm thrilled to see so many dedicated professionals joining us here today. First and foremost, let me extend a warm and enthusiastic welcome to each one of you. Whether you're a seasoned radiographer with years of experience or a newcomer to the field, we are delighted to have you here. For those who may not know me yet, my name is Mateusz Abratański and I'm director of Abram International. It's my privilege to be hosting and organizing this webinar. I would like to really warm welcome our presenter, experienced radiographer and partner of Abram International, who will be leading you through today's session, Ms. Wioletta Werszner. Viola, please say a few words about yourself.
Hi everyone, it's lovely to see you all. I wish I could see some faces, so if you do want to turn on your camera, I don't mind. So I'm not just speaking to little boxes. But yeah, my name is Wioletta Werszner and I'm Diagnostic Radiographer in UK. So this is going to be our focus of the presentation today. Okay, so I'm currently a CT radiographer. I'm going to tell you a bit more about my career pathway in a moment. So let's make a start. So I know that a lot of people here are looking to work in UK, and there were multiple questions about what's the best way really to apply for a job in UK. The most simple way is literally using your browser. So there's websites called NHS Jobs. You can find some jobs on Indeed, as well as you can find some jobs on Track Jobs. Some people do use LinkedIn. I've been approached via LinkedIn multiple times by different agents. In my previous job, I did manage to actually secure a good job through LinkedIn before, but you have to be very, very mindful. I think as my advice would be probably apply for first job through NHS Jobs website, because you'll be employed directly with the hospital. There isn't going to be any sort of medium in between. Another way, some trust websites, they will advertise sort of job applications straight through the trust website, and that's also another way. But you need to be mindful. Obviously, there's plenty of hospitals in UK, so you would need to search through literally every single hospital. So your NHS jobs website is probably the best one. Now I know from the past, you can actually email the management, so the imaging superintendent, who's basically the manager of the imaging department, to check whether there's any upcoming jobs. Perhaps you've got a friend that works in that specific hospital and you are currently thinking about moving to that area, or you're just looking basically to progress within the career. So they'll be more than happy to actually listen out for your emails, and then they might let you know, actually there's going to be a job coming up in the next month, or there is any jobs, however we can keep in touch. So that's sort of another way. And at the bottom of the slide, you can also see, apart from NHS, there's Maxima, which is also like a basically recruitment agency. Ramsey Healthcare is definitely a big one. They do have private hospitals, I believe. Same with Spire Healthcare. So there's definitely plenty to choose from. However, having solid basic NHS experience, I'll probably advise you to do that as a start of your career in UK. Okay, so a bit more about applying for the job, because that's, I think, another hot topic that a lot of people are trying to apply for the jobs, but it's just, you can't get through that initial application process. So in terms of writing your application, there's multiple things that you need to consider. Okay, so the main one is your person specification and job description. You probably heard that a million times. I was actually listening to a live on Instagram yesterday about NHS careers, and the lady sort of specified that as the first thing during live. So it's definitely out there and you have to sort of read them and you have to write your application according really to job person specification. But I'm going to tell you a bit more about supporting evidence in a second. Now, within your education section, I've noticed that some people, instead of just writing, for example, what degree you've got, sort of degree in radiography, a lot of people include the modules, individual modules that you do. That's not necessarily needed. So if you have completed, let's say, a 2-year sort of school or sort of university degree, you can just write the title of the actual qualification rather than individual modules. So that's just my advice, really. And within the work experience section, although they might ask you about different duties, what did you do in that job, try to keep it short, because you're going to write a lot more within your supporting evidence. So just basic duties that you did. And also it would be really, really good if you do have all the experience outside of radiography, if you worked as a healthcare assistant, if you did some admin work, you are more than welcome to add that within your application, because it will just make you stand out more by demonstrating, let's say, your communication skills or your writing skills or compassion, because obviously you worked as a healthcare, so many other. Okay. And the big one, you do need HCPC registration, really. That's, I think, within the sort of initial screening of applications. If you don't have that straight away, they might just reject the application. So if you don't have HCPC registration, that's definitely a must. It's part of the application, really. If you do have any additional courses or qualifications, also put it down. If you did a first aid course or some kind of health and safety, or maybe you did some other radiation protection related courses, definitely put it down, because it's just going to make you stand out more. Now, I do know there's people from probably all over the world at the moment, so different countries, and we do speak other languages. And again, if you don't write about your also other language that you speak, you're missing out. You're missing out, because at the moment, NHS, the patients that we see every day, they are from multiple backgrounds. So I speak fluent Polish, and even yesterday I had to go to cath lab to translate to a patient that just had a heart attack. So there'll be multiple situations where you can help out, and employer will appreciate. So if you do have additional language, make it sort of clear within your supporting evidence, and that's definitely going to be a bonus. Okay. So in terms of supporting information, consider these questions. Okay, so why do you want to work in this trust? That would be probably my starting sentence. What can you really bring to the team? So even saying like what kind of hobbies you've got, what kind of character you are, that can also give them a clue whether you will actually fit in within the team. So that's quite important. Have you researched the trust values? So in the corner, you can just see an example. That's NHS Trust of Sutherland in the south of Simple for sort of trust values. And again, within your job application and your interview, you're going to have to demonstrate that you can fulfill these values. Now, is your trust that you're applying to has got any improvement projects? That's also an important one. So during my interview, I did make it clear that I've done the research about the trust, and I did ask about the improvement projects and why did I want to even apply for the job there? Because I wanted to be part of that improvement. So that, again, things like that will make you stand out more. Is there any sort of new equipment? Why the imaging department is expanding? If you do know answers to these questions, that's definitely a bonus. And probably one of the important ones is your weaknesses. So a lot of people love writing about things that you can do, things that you are best at. but have a think about your weaknesses, because that can just catch you out. And I think I did had a question like this on my interview, sort of talking about weaknesses, but then how can you actually change them into strengths? So my probably biggest weakness is the perfection and attention to detail. Some people don't like it, but then again, from the employer point of view, it was actually a strength. So during my interview, they said, actually, you do realize that with like it is your strength really, and I said no, it's my weakness, because a lot of people sort of don't like this approach to the job. So just try to think of certain weaknesses that you can potentially, you know, change them into your strengths. And again, person specifications. So within your supporting information, you must match by giving examples of specific person specifications. So if they talk about effective communication, multidisciplinary sort of teamwork, and many other examples of, I'm trying to think, probably some more technical examples as well. Again, just give examples from your life. It doesn't have to be work specific. It can be sort of an example from your life, as long as it's relevant and you can demonstrate that. That's what they want to read within your supporting information. Try not to repeat what you already written earlier. So if you've already mentioned about your education, try not to repeat that, because they already know that. If you do want to write more about your experience, try just keep it to sort of the major sort of bullet points or something like that. If you're gonna start writing the whole protocol, you know, you'll be missing out on the word count, and you're probably not going to deliver the information they want to see. Okay, so just be mindful of not repeating certain sentences too much, and just keep it a nice structure with sort of some kind of small introduction, your body, and then a little summary at the end, sort of conclusion of why you're applying for this job as well. Okay. Well, submitting your application, just to make you aware, there might be a bit of a wait before you hear anything. So don't be sort of alarmed if you don't hear anything, even in 4 weeks' time. Because I remember when I've applied for my job, I think it's been good 3, if not 4 weeks, until I've actually heard something. And if you do hear something, hopefully it's going to be invitation for the interviews. That's me back in January 2021, terrified of going to the interview. It was a bit of a challenging interview with multiple technical, non-technical, and tricky questions, but I've made it. Okay, so you are halfway there. If you do get invitation for interview, absolutely well done, because that means you are meeting the person specification, and you're sort of getting there. So my advice would be, again, to read your application before you go, and make sure you remember what you've written within your answers, because it's going to be good 3, you know, even 4 weeks before you even get the invitation. So just remind yourself what did you actually write in your application. Revise trust values. They might come up, they might not. They might come up maybe structured, so within the question in a different way. They might, for example, ask you how can you demonstrate compassion, or we had a conversation with Mateusz this morning about more competency sort of questions, how you can demonstrate certain competency. So it could come up in that kind of style. And just be aware of trust values and like different examples. But all that information can be actually found on the website. So it's very easy, accessible, and it's available, and your employer will definitely make it clear within sort of the job advert as well. Now, few simple questions like, why do you want to work here? Why are we going to employ you? They might come up, they might not. they did come up on my interview, and my reasons, for example, for getting the job that I wanted is because I was moving back to the area actually where I grew up as a teenager. So my mum and dad live in this area, and I said I just want to be back within sort of my family in my friendship zone, and I'm planning to buy a house, etc. So they know that this is not just a temporary stop. They know you want to you want to assure them that this is actually your permanent sort of solution for your future. So if you do make it clear, why do you actually, why you're looking at things like sort of life examples, you can use that within the answer for that particular question, basically. Okay. So what kind of questions can you expect when you get invited for the interview? Okay. So basic life support, they come up all the time, especially with the band 5. They do. I don't know why, but I'll tell you later about my band 6 interview. But band 5 interview was really a tough one. Basic life support. So that could be multiple questions regarding CPR, what you do, your A, B, C, D, E, and many other. Also moving and handling. They might give you some tricky questions. So just to give you an example, let's say you are about to pat slide the patient from trolley to CT table, and you've only got your band 7 radiographer and yourself, and the band 7 radiographer says, okay, let's pat slide. Is that safe? Absolutely not. The minimum really says within the health and safety rules you should have 4 people. Again, it depends on the size of the patient as well. But things like that, you just be mindful, because they do. Sometimes there's no right and wrong answer, basically. Sometimes you need to be creative within your answer, and just so show the reasoning like behind your actions, basically. So in terms of radiation protection basics and challenging situations, again, I can give you an example with that. So let's say you are in a theatre, you're doing your sort of fluoroscope screening, and another surgeon, he's just popping in to see his other surgeon colleague, and he wants to check something with him, but he came in without wearing lead protection, and he's standing behind the nurse. This is something that probably happens a lot everywhere. Is it acceptable? No. What would you do? So this is the kind of situation and challenging question you might get. From my experience, the answer to that question can be sort of from literally a radiographer leaving the room with the key to the machine, up to like was sort of agreeing to stay behind the sort of lead curtainless or curtain for some time, but really it should be for emergency only. But yeah, I have met a few people that had a similar situation, and they just they said, this is not right, it's against the law in a way, and they left the theatre with the radiation key, and basically the manager had to intervene. So again, the answers to these questions can be various. You can sort of answer it based on your own experience in a way. So I'm mainly gonna give you examples from like plain film and CT. I've not been to MRI interview, but I've been to nuclear medicine interviews, so I can tell you a bit more about that as well. So with plain film, with the technical section, it's mainly going to be exposure factors and how would you sort of perform certain exams, bit like adaptive technique, but it might catch you out on some questions like you're going to do a portable X-ray resource. Would you use AEC? And obviously the answer is no, because you're going to use 3 detectors, so that's not going to happen. But when I was asked this question, I just said, perhaps in the future, but not right now, just to make them smile. So there will be like maybe not silly, but like, yeah, in a way, silly questions that they're going to try to really test your reaction to it. Okay. With CT, they're going to ask you about the basics. So how do you perform CT head, which is very, very common scan that we do on a daily basis. What would you do with contrast reactions? You know, what types of contrast reactions are there? So again, that would be part of your questions. With nuclear medicine, there'll be additional safety questions. What would you do with the spillages of radioactive nuclide, and some other sort of protocol-based questions. Again, it could be related to questions to teamwork, communication, to give some examples. So yeah, I think move on to the next slide now. So it's okay not to know all the answers, okay? People, I think, get stressed out that they have to answer every single question. No, you don't have to.
Wioletta, is it okay to interrupt you?
Yeah.
There was a question from Sumaira, what in a chat. That's regarding the applying for a job. That's regarding just at that stage before the invitation for the interview. So what's the answer of the third point? I presume that was regarding the health and safety. However, I think you addressed that pretty well. So Myra, if you'd like to put your microphone on and ask that question out loud, trying to be more specific in what you mean. So I'm sure Wioletta would be able to address that question. So Myra, can you hear me? I'll just try to write.
Hello.
Hello.
Hello. Is it? Yeah, is this Myra? Yeah.
Yes, I want to ask, what have you researched trust values? My question from applying for job band 5. What will be the answer of this question? Have you researched the trust values?
Can you repeat it just one more time, Samara?
My question from your slide, applying for a job band 5, supporting information. The interviewer asked from me, your third point is, have you researched the trust values? What will be the answer of this question?
Okay, so the trust values basically is an example of certain goals that the hospital has highlighted, and these are the goals that they want to work on, and that's in a way they are expectations from the employees. So everybody, like all hospitals, this was introduced actually not that long ago. I'll probably say about maybe 10 years ago, maybe a bit more, but it's a fairly new thing. So it could be like just 4 bullet points in a way of compassion, teamwork. Now, when you're applying for the job, your employer should include that within the job advert. So where you've got your sort of files for person specification and job description, quite often they also add information about the trust or trust values. If that's not there, try to go onto the trust website of that hospital, and then within the search box you can write sort of what are the trust values, and again the values are basically the goals that the hospital wants to work towards and this is what they want to deliver to the patients, and just overall sort of as the overall service. Is that did that answer the question?
Thank you, ma'am.
Okay.
Okay.
Any more?
Also, also Joseph asked a question. However, Joseph, it wasn't specific enough. Could you try to ask this question again? Because I wasn't sure whether you're asking for a job, whether your question was related to the job application or HCPC application, or both. Hi, Joseph. Could you address that question again?
Hello, good morning.
Hello.
Oh, hi.
Fine. I want to appreciate you for the organization of this webinar. At least this one, we elaborate on applications. So, but there's a question that bothers me. I happened to participate in an interview with a trust, and the outcome was unfortunate. It was not successful. So I requested for a feedback. So they sent me feedback, and they sent me the areas that I didn't score high. So I was able to study them. They also advertise again. So the same band. So I read through the feedback that I got initially. So I was able to participate in the interview. I got the interview, and then I participated again in the second interview. I was so sure that I read exactly what they told me that I should have done. So I answered, and they repeated the same questions that they asked. And I was able to give them the way they initially gave me the feedback. And I've not been successful. So I wanted to know why.
Yeah, Joseph, I'm trying to address that. So if you need some support regarding preparation for interview, this is something what here in Abram International we do. You can provide the consultation. We'll talk about this a bit later. In regarding how to prepare the interview, I'm sure that's going to be next subject from Wioletta, so she will talk about this. But in relation to the job application, Wioletta, would you like to add anything to address Joseph's questions?
Really to look at the bigger picture and what happened is probably if I sort of assess actually your application, because it's really hard to say like why didn't they accepted you. So probably I would recommend like one-to-one session, but the reason like the reasons why they wouldn't sort of give you the job even second time, there could be multiple reasons. The fact that they've not had maybe enough positions, maybe it was just advert for one position, maybe it was an advert for 3. Sometimes radiography, they employ sort of multiple people per job advert, but you have to bear in mind there will be a lot of graduates every year as well, so people from UK applying for the job, so it can get, I think it can get quite competitive for the international applicants, because they basically, for them in a way, the whole process of recruitment is basically easier to employ someone that's already based in UK. That doesn't mean that they wouldn't, because I've got a lot of people in my hospital that were employed internationally and they were successful. So again, I can't give you the right and wrong answer. My only advice is don't give up. Try to master again your application style and your interview style, and practice. I mean, I've applied for a few jobs in the past and I didn't get my job first time. So, you know, but I didn't give up. So I think try to obviously apply to different trusts as well, and maybe arrange informal meeting. That's my advice.
Yeah, I think that's the most important thing regarding the job applications. Do not give up after first, second, or even after third. Sometimes you need to send us 10, 15 job applications and learn after from each one, from the feedback. Ask for a feedback, and then try to learn on it and try to apply all these suggestions to the next job applications. Yeah, regarding the interview, I'm sure Wioletta will say a lot in a second, because I can see the next slide is coming, invitation for the interview. However, just one more thing from Zofia SL. Does NHS contact everyone even if they are not interested in my application /CV? Wioletta?
No, unfortunately, if you're, I mean, they will contact you even if they are not if you're not being successful within sort of the initial application process, they will make you aware that you're not anymore under consideration. However, if you don't really get much feedback, so if you do want the feedback, let's say on the initial part, why you didn't get invitation for interview, it's always worth to get in touch with that HR person that's specified within the job advert to say, well, can I have some feedback about my application? But you have to be aware that the way how they screen applications nowadays, they actually they're not aware of a lot of details like your gender, your date of birth, your name. So a lot of it is based on your education, your supporting evidence, your HCPC registration. So it's to make it basically fair and not to make, I don't know, a judgment on the way. They just try to sort of remove these information. So your application is actually screened without these specific details. In terms of contacting after interview, again, they should give you a phone call. They should give you some feedback.
Let's go to the next subject, and if there are any more questions, we'll try to address them as best as we can. Is that okay, Viola?
Okay. Yeah, that's fine. Okay, I'm going to move on back to the presentation. So, step close to success will be your interview, and just like I started, it's okay not to know all the answers. Okay, sometimes people sort of stress out and they struggle to answer certain questions, you know, under pressure in a way. So just breathe and take your time with answering. Okay, and if you don't know the answer, you can always reassure the panel and just say, I'm not quite sure about the answer for these questions. However, I'm going to do some research and I'm going to try to find out the answers, so no, for the future. Okay. In case you did not quite understood the question, ask them to repeat. I've had a BLS related question in my sort of interview, and the answer was very simple, but because I was under sort of pressure, under the stress, I've asked them to repeat it 3 times to give me time to think about the answer. So ask them to repeat, restyle, and use that time really to try to get the answer. So you don't have to rush with your answering the questions. Now, a lot of people, a lot of employers, they do like to see a CPD file, that you've got one, because that just shows that you're up to date, that you're thinking about your education. So keep it. If you do have a file, and if you're going for a actually physical interview, then keep it visible, have it with you, and you can always pass it to the panel when they ask. If your interview is online via sort of web, then what you can do, just create a nice PDF file that you can share day before the interview, or you can ask them during the interview if they would like to see your CPD, or just simply send it after your interview. Okay. Lastly, I would probably just thank them for this opportunity, that you appreciate them having you, and definitely ask for feedback. And I can see already a lot of people have been doing that in the past, which is great. Feedback is your friend. Feedback will try to help you improve and just make you better in certain areas where you're basically missing out a little bit. Okay. We did the questions, but I had actually prepared the slide after this. I don't know if I think we've covered some questions, so I probably wouldn't have any at the moment. So I'm gonna probably move on, if you don't mind, Mateusz. Yeah.
That's fine. Yeah, that's all right. Yeah.
Okay. Just to let you know, we do offer one-to-one sessions with the experts. So I'm part of the team. We've got a team of physios as well. Obviously, we've got Mateusz, we've got Zofia. So there's quite a few of us that can help you with whether it's HCPC registration or your job application guidance, interview preparation. So we do offer that help. Okay. So within the final recruitment stage, so if you've been successful with your interview, that's sort of, it's not the end. it's just the beginning of your recruitment process in a way. You have to respond to any HR, so human resources queries as soon as possible. Okay. They might ask you multiple times for the same thing. They've done that to me. The whole HR process can take weeks. Okay. If you just to give you an example, I've managed to secure the job before I graduated. So I was given the job in January 2021, but I didn't start working until July 2021. So I had that 6 months of the whole process really, and probably because they knew I wouldn't start until July, they postponed certain things. Okay, but I would say as a standard procedure, it's probably good 6 weeks, if not more. If you can get a lot of documentation sort of quicker, it really depends on the HR team working within the hospital. Okay, so just again, be patient. Send absolutely only original documentation, and obviously if it's translated, it has to be certified. So make sure you've got your original documentation, whether it's your education certificates or some other certificates. Ensure your referees, so people that you've put on the reference, are aware that the hospital might get in touch. It is, I'm pretty sure it's a compulsory sort of feature of the recruitment that they do need reference. And even when I was sort of getting my band 6, and I'll tell you a bit more about that in a second, but I was transferred from X-ray to CT, and obviously we've got different management team for these modalities, and my recruitment process in a way was on hold because they were waiting from my old manager to give me the reference. So, you know, that can hold your starting date. So make sure your referees are aware and they respond to the email from the hospital as soon as possible, really. So that will speed up the whole process. Okay. The hospital might also ask you to complete any sort of necessary core mandatory training. So that's your basic BLS, fire safety, your manual handling, but that's mainly sort of done in practice within a sort of like a training room. Same with BLS, you have some theory, but also you're going to have a hands-on training. Okay. It could be something like confidentiality, your information governance. So things like, how do you protect patients' data? Why do you have to protect patients' data? Things like that might also come up in the interview. So like, why confidentiality is important? Okay, and moving on. Let's say you got the job and you started working in NHS. You'll get a big welcome from the team. You'll probably get a big package of different documents they have to read through and then sign off that you've read them. That's going to be part of the process. I'm just looking at some here actually from my CT, but my band 5 package was a lot bigger, I'm not going to lie. In fact, for my band 5 package, I spent 2 days reading policies that were sort of set out on different desks, because this is how my manager organized it. So she wanted to make us aware of everything before we proper started clinical. Now, NHS culture of staff come and go. What do I mean by that? Don't be alarmed if, let's say, some people will give you more attention than the others. Okay, we do have in some trusts there will be sort of more agency staff and permanent staff. Not everybody will sort of come along and say hi, but don't worry about that. Just give it time, absorb. NHS is a very busy organization, so our workload is usually high, very high. So just try to absorb and observe what's going on around you. My advice also would be probably not to compare your previous experience with the new workplace. Treat it like first day in school that you don't know anything. The more you don't know and the more you ask, the more you're going to learn. Okay, So even though you might have experience of doing things slightly differently, if as long as it's still within the standard operating procedures, so the way how this trust work, and it's safe, that's fine. But do try to come with a mindset, yes, you have experience, but you don't have experience in that hospital. And I've noticed, even though I have some healthcare experience, things like communication, I don't know, sterile work, because I used to work as a dental nurse, and I've got some transferable skills from that. That doesn't mean much to the others, basically. So just to make you aware, try to just learn on the job, really, and try to focus on the things that what takes place in that hospital. So really learn the basics, try to shadow people, but probably your manager will organize that anyway. In the first 2 weeks, you'll be shadowing, and then you'll be sort of let loose to do your own thing. Okay, so make sure you're familiar with local rules. What that means, they are so your basic radiation rules, basically, policies, and your standard operating procedures for different examinations. So what's within standard operating procedures is, for example, how do you perform certain X-ray, or like how do you perform the scans? But again, that could be under, for example, protocols for scans. And a lot of that information will be made available via sort of trust website. So for example, in my trust, the imaging department has got something called SharePoint, which is a website designed specifically for the employees. So we have access to all the documents, all the operating procedures, all the standards, and sort of authorization criteria. So you can access that whenever it's needed. I mean, they do, the employer knows that you're not gonna know everything that's out there. So they really want to make it easy for you to make these documents sort of available. Okay. On your first day, just ask questions, make some notes, and ask again. And try not to really get too much overwhelmed, because you're gonna come back the next day and the after and the after. So you're gonna learn more. Okay. And absolutely do not carry out any task that you're not sure about. Okay. So that's probably most important advice. Even if you feel like some member of staff will give you a task to do, if you don't know how to do it, and it's regarding sort of patient, what could be patient safety related, and just say, actually, would you mind helping me with this one? You just don't want to carry out the task. Okay. So a little bit about agenda for change and your salary within band 5. I just want to tell you really a bit more about agenda for change. So this is yep.
Yeah, just wanted to ask up loud whether there were any questions regarding the previous subject, like first day at work, and what happening with a professional and two professional after that successful day, when you're successful in the interview, and what happened then. Anybody got any questions towards that? Or if not, we then carry on. Just a quick reminder, if there is any question that you don't want to say out loud, you can always write it in a chat room. Feel free, and as I said, we will address them in a first available time. All right. Okay. Sorry, Wioletta. So yeah, carry on.
No, that's fine. I had a little break to drink my water, so I'm sound.
It's good. Yeah, that's important, especially when there's so much to say, and that's all amazing. It's all really, even for me, I'm only a paramedic working in ambulance service. However, it's all really interesting to see how does it look from the other healthcare professional, from other professional point of view, and what's their experience. We had a quite good chat before that. webinar, and we could share a lot. But I'm not wasting your time. Just keep carry on. I know there's a lot of interesting things to say for you. So yeah, I'm muting myself now.
Okay, so let's move on to the next one. So finances, again, I'm sure people are attracted to come to UK because of the salaries that you can achieve here comparing to your home countries, and I don't blame you. So with the agenda for change, there's a standard NHS pay system, in a way, pay salary system. So I think in my home country, probably maybe some people could say more about it, but I don't think you have something like a set salary standards for all hospitals in the whole country. So this is what we have in UK, a set standard for all NHS hospitals, for all the allied health professions, nurses. I think it's mainly doctors and certain higher management people, they don't come under agenda for change, but everybody else will come really under agenda for change, and this is just to pay the salary system that we have in UK for all hospitals. Okay, now people that work in London, within sort of London city centre or just outside of London, they'll get additional enhancements. So on top of the figure that you can see for the entry point, there'll be additional money really for people that live in London. I mean, I've lived in London for 3 years. I've studied in London, so I know how expensive it can get there. Okay, and then within the band 5, you can progress with sort of getting different increments. So the first one will be in 2 years' time. It's mandatory to have an appraisal with your manager. So what's an appraisal? It's a meeting where you decide with the manager, have you met different goals, or like you setting new goals, for example, for the next 2 years. It could be anything related to attending a conference, or maybe you want to complete some additional radiation protection training, or many other. And you also need to make sure you've got your mandatory training. So training, the core training I was on about earlier, that they have to do before you start work. Unfortunately, a lot of them, they have to be renewed every year. So the education just doesn't stop. And then you've got your further progression within another 2 years. And again, it's the same thing. You have to do your appraisal, so your meeting with your manager. Make sure that you sort of show how did you meet the goals and what are you working on. Again, they might ask about your different strengths and some weaknesses that you want to work on. And then they're gonna do the sort of the pay progression. The actual pay progression is all done within sort of payroll people and the finance people. But there's these two boxes that you have to tick really, and then they're gonna handle the whole process for you. Okay, so a little bit more about rotations within general radiography. So I've started working really in plain film. We mainly work with DR and CR equipment here in the UK. I've not seen plain film, so you're not going to see that probably anywhere in UK, but just DR and CR equipment experience, that's probably what the main thing you want to mention about within your job applications as well. Okay. And so you might be working in, well, a very high chance you'll be working in emergency department. You might work in orthopedic fracture clinic, outpatients, so any sort of GP as so your local doctor's appointments. And there is a thing called community diagnostic hubs. So they'll be what that means. They're trying to expand the diagnostic centers and sort of the way how people can get the certain x-rays or let's say day case endoscopies done quicker rather than attending the hospital itself for any sort of less let's say less life-threatening, but something that needs to be checked They do trying to create more of these community diagnostic hubs to make it more available for people, because at the moment, unfortunately, the waiting lists are really long, and that's why there's so much to do within NHS. You might also work within the theatre, so your usual orthopedic, spinal, urology, so pediatrics. If you do want to mention about your experience in theatre within your supporting evidence, for example, that's probably the way how you can explain to your potential employer, you know, what experience you've got, and maybe you can mention about certain sort of difficult situations that you've had, you came across, what was the result of it. You'll be probably also rotated for portable imaging. Now, in my trust, we actually have a dedicated 2 radiographers to do portables. It's a massive hospital. So yeah, we do need a dedicated person to do that. And usually it's done on the rotation, so it's not going to be the same 2 people all day, every day. But you have sort of dedicated radiographer for specific days. And again, you'll be going towards neonatal special baby units, you'll be going to ICU, resource. Now with portable imaging, there's a tight criteria of who can get portable X-ray, so just bear in mind, sometimes with certain wards, you might have to refuse X-ray requests. So I have mentioned that in my, I think, previous webinar, that there's certain criteria, and as a radiographer in UK, you are a practitioner and you have to really justify every single X-ray request. Any request that's been done legally, you are sort of responsible for performing that examination, but you have to always rule out sort of benefit versus risk. Okay, so be alarmed that sometimes you will have to refuse. Okay, within CT and band 5, so in some hospitals, let's say, and somebody on the night shift, they might gonna have to cover CT and just do some plain emergency scans like CT head or CT KUB, so kidney, ureter, bladder, just your abdomen, looking for some stones. So that will be it's going to be very basics. If you're mainly employed within general radiography, you probably wouldn't do that much CT. Now, for the band 5 roles, there's also, you can also find some training posts. So if let's say if you don't want to go to plain film and you want to try something else because you already have experience in CT or MRI or interventional radiology, you might find some training posts band 5, and these are great because you can sort of access these modalities straight away without going to your plain film first. What these posts, they really focus on training, so employer expectations. I'm sure they're going to take that on board, so you definitely have more chances of getting that particular role. Okay, any questions about band 5?
There was a question, however, not strictly regarding, well, still regarding band 5, but still regarding the process of getting the position, applying for a job, getting onto the interview. The question is how to get shortlisted onto the interview. I think this is a very, very open question. And we had separate webinar regarding this. That was aimed at physiotherapists. That is, that webinar is available on our online shop. However, regardless, it was targeted onto the physiotherapist. I think it's still the knowledge that we provided over there, it still might be useful for other professionals. As I said, for me as a paramedic and for I believe for radiographers, that knowledge would be very useful. So if you like to, you can try to listen that webinar, just contact with us. We will provide you with the details. However, Wioletta, would you be happy to address that question just briefly?
I think you are totally right, because I know the webinar done by Patrick is absolutely amazing, and he has so much experience, so he's probably really the person to answer that.
Yeah, I wish he yeah, carry on, sorry.
But like from my point of view, how to be shortlisted is certain boxes you have to tick. So I've mentioned before, like your HCPC registration, your education, your really experience, and job specifications, your person specification. If you specify them, with examples and relate to trust values, all these elements will really help you. And any sort of additional qualifications that you've got as well will help you. Yeah, but Patrick is the expert.
Yeah. Just to get it down to really basics, because obviously we can spend enough time on that. However, it's really important, especially for everyone who's trying to get onto the position, whether it's a physiotherapist, whether it's a radiographer, whether it's a paramedic. The main thing is to read, as Viola said, is to read the job description and personal specifications. As long as you can tick most of the boxes, and if you can tick if you can address all the essential points from that job description and personal specification, sorry. As long as you can address all that essential things, and if you can add anything extra, you should be shortlisted onto the interview. But yeah, on every job adverts, there's a PDF file or Word document where the employer has to describe what's the person specification, what's the job, what's the description of the job, and what she is expecting from you. And if you can address all the essential criteria, you should be shortlisted. Obviously, we cannot guarantee that. However, as from my experience and from our experience, as long as you can meet that criteria, you should be shortlisted. Viola, would you like to add anything on that?
Yeah, I'm just gonna add, because some people might not know what's essential, desirable. So within your person specification, I don't have a screenshot example, but within your person specification, you'll have a box for essential criteria, and they will make it clear. You also have a box for desirable criteria. And on the last box, you normally have method, how this is assessed. Okay, so there might be method. They might say I for interview, A for application, or T for test, because for some positions, they even might give you a little test, competency tests, okay? So within your job descriptions, like Mateusz said, you have these boxes, and the more essential criteria you mention within your supporting evidence, and you give example of how do you meet them, absolutely the higher chance you'll get shortlisted for the interview.
I can see no other questions in the chat, so unless you people have any questions, please raise the hand, please write it in the chat, unmute yourself, this is your time. But if not, we'll carry on. Yeah, we'll carry on.
Yeah, okay, we'll carry on then. So next one, stepping up to band 6. Okay, so if you want to step up to band 6 from your band 5 job, let's say you've worked as a band 5 for about 2 years, maybe a year and a half, and you're very keen, and you do want to do a bit more within your career pathway, there is a progression. There's a progression within radiography. You can do a band 6, you can do even band 7, or even end up as a band 8, but that's sort of later on within your career, really. But as a band 6, it's a new role, it's a new job application, even though you're working in the same hospital. So I moved from X-ray to CT. These departments are run by different management teams. The trust where I work is absolutely huge. So we've got basically teams for MRI, X-ray, CT, interventional. So I had to go through the whole recruitment process, which is similar to Band 5. I had my interview, I had to send my application, I had to provide reference, literally from one manager to another, where the offices are probably like 20 meters apart, but they had to send, you know, the reference by email. So a lot of these things needs to be done. And now bear in mind also, when you're applying for Band 6 positions as an external applicant, you have to be mindful of the internal applicants, because they are your competition. So you really have to make your application stand out, and you have to perfect your interview skills in order to get that Band 6. Okay. So within Band 6 role, there'll be some additional duties. So for example, shift leads. So you'll be, let's say, the main radiographer on clinic for that day, to keep an eye on your patient list. If things go wrong, you're probably going to be the first one to speak to. Any sort of daily checks that needs to be done, like your crash trolley checks, your contrast reaction drugs, for example, in CT, or some other basic checks like just checking your oxygen on the wall, make sure the pressure is okay, your suction's working, your crash alarm's working, many other. Now you're also going to support your junior colleagues, so they will come up to you and ask questions. And I found that especially within plain film, so within the X-ray department, the Band 6s, they were my sort of key people to speak to, especially as being newly qualified at that time, 2 years ago. They were the people that were really helpful with their experience, and they are always sort of available, so don't be scared to ask them questions, and or even just, can you please show me how to do this, basically, and they are there for you. If things go wrong with any sort of equipment faults, then usually Band 6s are responsible to report these faults further to sort of Band 7s and management level. In some hospitals, they want you to have good PACS knowledge. So what's PACS? It's basically a patient archive system within the hospital. So any images that are being done, whether it's X-ray, MRI, CT, nuclear medicine, they all end up on our PACS, which is our sort of database for images. Within PACS, certain people like radiographers, we have additional sort of permissions to do certain things. For example, if you've sent an image under sort of incorrect package accession number, they're called, you can sort of move images from one package to the other. So it makes sense for clinicians when they open them up. Okay. Sometimes, for example, with CT, you'll have multiple scans they have to do. With the trauma scans, you might have like CT head, and then you have to do your neck, and you do your full body scan. And normally, if you open up all these packages, they should go to the right place. But again, if you do have that PACS knowledge, that definitely is going to make you stand out, just so you know how to approach certain problems. If you don't have any PACS sort of knowledge, and you're thinking about applying for Band 6 within sort of radiography and X-ray, I would probably suggest to sit down with the experienced radiographer and knowing the ins and outs of PACS, because that will definitely make you stand out. And within the further progression in the Band 6, again, similar to Band 5, where you have 2 years appraisal, setting your goals, what did you achieve, what are you planning to achieve, and then you have a further progression in another 3 years. Okay, with the modalities covered by Band 6 radiographers, again, there will be plain film, interventional radiology, it could be CT, MRI, cath lab. In some hospitals, you have radiographers on Band 6 rotating between X-ray, CT, and let's say cath lab. But again, it's gonna vary from trust to trust. So yeah, it can be just one base modality like in my trust, or it could be rotation around between different modalities. It really depends on your management structure. If your management structure is divided into modalities, then it's going to be really difficult to combine X-ray with MRI, for example. It's not impossible, but it might be difficult in some places. Okay. Now, I'm just going to tell you a little bit more about my own experience within the plain film. So I was lucky and unlucky at the same time to do to do my university degree in UK. I have moved to UK in 2006, so it's been good 17 years actually. But I have so why I was lucky and unlucky is basically my degree, half of it was COVID and the other half was normal life. So you can see me here getting ready to go to resus to do a portable x-ray. So I was very lucky to have my university placements done in London. I've worked in had my placements within different London hospitals, bigger ones and then smaller. So I can tell you a bit more about differences between large versus small district and university hospitals. Large trusts, they will specialize in doing more advanced stuff. So anything that cannot be achieved in a smaller district hospital will be shipped back to the large trust and referred for any special procedures or maybe more specialized scans that are not performed within the small district hospital. Small district hospital can be actually quite busy environment because they will do their the basics, plain film x-rays and then the basic scans. So it can be actually quite a busy hospital if you think about it. We're comparing to university hospitals, they're going to have obviously a lot of students on placement. So you've got your staff, you've got your students, so it can get quite busy. The expectations really from staff that work in the university hospitals is to train, is to give support to students, and that's also within your job description. So if you do have any experience of teaching students and giving them support, again, you should make sure that you include that within your supporting evidence within your job application if you are applying for a job within the university hospitals, teaching hospitals. So major incidents. So my experience with major incidents is really as it stands. So I've been through cyber attack. I was on placement when the terrorist attack actually happened in London on London Bridge.
Wow.
Yep, and I was when I was working, we had a massive IT system shut down, and phones were not working. There was no order comms. Nobody could order examination. Nobody could access packs. And I had me and actually my team, we had a big thank you from A&E consultants because we actually were able to carry on working. And we have again the whole policy and processes in place for major incidents. And obviously things like terrorist attack, they hopefully they're not going to happen too often, but unfortunately living in the UK means that you have to be aware of these situations because they have taken place and they probably might in the future, so you have to be aware. But things like IT system down, that can happen often enough, so you would need to be aware of what to do in these situations. But again, you'll have full support from your band 6s, band 7s, and then your management will get involved, and there's a whole chain of events and domino effect of what's going to happen next. Okay. Did you want to ask anything, Mateusz? Because you unmuted yourself.
No, well, that was a moment when you actually mentioned the major incidents. Obviously, that's
I knew you were going to say
slightly a bit of my area due to my profession as a paramedic. No, I was just wondering how did it affect you, to be honest, emotionally? Because being here, because we are based in Yorkshire, so it's quite far. It's in the middle of UK when you're down in the south. However, we know how it affected us, but I was wondering how it affected you when you were like around the corner from this incident. And
So
yeah.
from the incident on London Bridge, I was literally about 300 meters away, because I was at the time I was at Guy's Hospital, which is
Wow.
the closest hospital to London Bridge. So we had a full shutdown of the hospital. Nobody was allowed to leave the hospital or enter hospital, basically. Even when I was leaving. So the incident happened sort of around 2 o'clock in the afternoon. We didn't know what actually happened. So a lot of the things that already started to take place within the management, we only found out a bit later. And the reasons for that is to keep people calm. Because the more you know, the more you might panic, really. So they kept the information to minimum, but the scale of what happened, I only found out when I was actually trying to get home, because London Bridge Station was closed. So a lot of people were literally walking in the middle of the roads in silence to the closest, or the Elephant and Castle, and some other sort of stations to get to home. So it was really, when I was in the bus going home, it took me about 3 hours to go home on that
All
day.
right.
I
Wow.
actually found out through videos, what actually happened, and the fact that I was so close to that, and I was there. It's just scary. It's scary,
Right.
but like, in a way, luckily there were no more casualties. So
Yeah.
really, the people that were the casualties, they ended up, I think, in St. Thomas's, because St. Thomas's Hospital, they've got a proper big A&E, whereas Guy's Hospital doesn't. It's more for outpatients, more for planned procedures.
Right.
So I was in St. Thomas's.
So, so going back to the profession, but still around this major incidents, did you receive any support from the employer?
Oh yeah, I've
Mm,
had a phone call on the same day as I was walking. Already got off the bus after 3-hour journey. Got off the bus, and I had a phone call from my university director to ask, "Are you okay?" Because you were there, and she calling everyone, and she said people have different reactions. But she wanted to hear how I feel, so we did had support on that same day. And if anybody needed more support or wanted to discuss actually what happened, then the university and so the hospital made it available to them. Yeah.
That's amazing. So yeah, that's good to know that you're in a busy city, you're in a big hospital, however they still looking after the employees. It's good to know you're covered. In the meantime, there was a question from Ola Grzyboska. Are there in the UK some private facilities with radiography, like Medicover or LuxMed, that refer to Polish private clinics, or can you only work in an NHS in a hospital? So basically, can you work in private sector? Can you work only in NHS? Can you say something
Yes,
about it?
we do have private sector as well. Probably the biggest sort of in terms of private sector will be Nuffield, which is a bit like Medicover. So we have Nuffield, we have Spire Health, we have Ramsey. I have mentioned them earlier within the presentation. So yeah, we do have quite a few different sort of organizations that deliver private care, and private hospitals, and sort of private clinicians, and you can get a job within that sector, although it's quite competitive. And also in terms of the pay rates, there seems to be very much similarities in terms of the pay. That's what I've noticed within the job adverts. And even after speaking about that with my colleague who works at Nuffield, she said that things have sort of changed within the private sector. It's not as good as it used to be, but again, it depends where about you work. I would say the best place for that would be probably in London. But again, you have to be mindful of the London prices and then the cost of living there. Yeah.
Do you think it's are there any difficulties or both the private sector and NHS following the same rules in regarding applying for a job interviews, how difficult it is to get the job, the time scales? Can you say something about this?
I think with the time scale and applying for the job, that might be quicker compared to the NHS long process. I think that actually might be quicker, especially if you're applying, let's say, through agency, and then this agency has a contact with the private hospitals, and you can sort of get employed that way a lot quicker. By giving them the full information, documentation that they want, you'll still have some kind of interview within your sort of agency process, because they have to demonstrate that to the hospitals that they have gone through all the checks, but the process will be quicker. I've lost the question. Do you think I've answered that one?
Yeah, you said about the time scale, but do you think the interview process and how you apply for a job is gonna be just similar way of applying, or do you think these interviews and job applications for NHS are tougher, or maybe they are easier compared to agencies, compared to private sector?
So I think they might be very, very similar, although with having experience of sort of working, although it's not within radiography, as a dental nurse, when I got approached on LinkedIn by a company called Hayes, it's a global company. They do, apart from healthcare, they do other stuff as well. They said as my part of my interview was to complete like a small worksheet as well. So they wanted to see my answers. They said they didn't want to just hear me. They wanted to see me like in writing, doing some of the questions. So the style can vary a little bit, but I haven't got experience in applying for private jobs in radiography, so I'm not sure whether they would do the same sort of NHS style, or whether maybe they're going to simplify, or then they might add some extras. If you think about it, private sector really relies on delivering very high standard patient care. I used to work in the private sector as a dental nurse, so really your client is always right. So you have to be mindful of that and just be careful, and really, if you can, what I would probably suggest is to just get in touch with them and ask, have a little meeting conversation. What are the expectations, and then things that might come up in your interview.
Yeah, that was my experience as well. And when I had a chat with other professionals from other, like as I said, physio or other professions, that working for agencies sometimes easier regarding choosing the shifts for agency. Usually you work for a bank, not always, but for a bank, so you just working as many hours as you want. And also the application process is sometimes a bit quicker, as you said, because they already have a set contract with this or that hospital, or if it's a private hospital, it's even easier. I know with NHS sometimes you need to wait a good few weeks until response. Right. Okay, I think we can carry on there. I can't see any more questions so far.
Yeah. So just moving on, I'm mindful of the time basically. We haven't got much left. So within the NHS, the workload is busy compared to private. So that's probably why some people move out of NHS and they want to work in private, because obviously the workload will be a lot less. However, you have to be mindful of many sort of legal, paralegal things, whether you'll be responsible and you don't get as much protection. So you need to make sure you have your indemnity insurance and things like that in place when you work in private. DATIC system. So what's a DATIC system? It's a system that we have in England, a bit like no-fault system. So anything that happens related to the patient or related to a staff member, anything that has happened or so it was near miss or close to happening, you have to report it. And the reporting is done via some data system basically. And normally within your trust main website, there'll be a little tab, report datex. And that means just report incidents. So you can just basically it's like an incidents reporting system. So I've had to report sort of another clinician twice within the first 3 months I started working. And why do we report? You know, some people will ignore certain things. However, if we don't make other people aware that somebody has made a mistake, we're not going to be able to improve. And that's the whole point of reporting. So it's all about keeping the high standards and also transparency, because in UK we have different hospital inspections. Could be CQC inspection. So if the hospital is not transparent and doesn't really show, you know, what incidents are happening, and then CQC. And so in my university, I had one of my lecturers. She's also a CQC inspector, and she told me once on one of the meetings that when she goes to inspections, she always looks forward to see actually what has happened, because it's a learning curve for everybody. So when she's going somewhere and if, let's say, like high incidence sort of level incidents are not being reported at all, then but she knows that basically they're just not honest, because things happen every day. It could be little incidents, could be something bigger, but the main thing is the learning from what happened and how can we improve it. Also accepting report against you. So if anybody reports data against you, make sure anything you do on a daily basis should always record any sort of actions that you've taken. Let's say if you were not able to do certain examinations, make sure you write within the radiology system why you were not able to perform, because maybe the referrer will pull data that you did not perform the examinations without giving any reasons. Maybe the patient refused, maybe the patient was unstable, maybe the patient wouldn't cooperate. So you always need to make sure you write this within the radiology notes. And if the data has been put against you, it's not a bad thing necessarily, but your management can always cover you because you have documented your actions, and they will always ask about your sort of events of what happened. So within different hospitals, you have different protocols. So where I've trained, for example, for shoulder X-rays, they were doing some different projections. When I started working in my trust, you know, they were doing totally different projections. There's some sort of standards that you know that are going to happen everywhere, but just be mindful that you'll have some additional projections, and you should always follow what's stated within your sort of local protocols, and you just basically follow those. So a little bit about CT experience in the UK. Contrast reaction cases, they are definitely the biggest at the moment. In the past 7 months, I've probably come across 2 minor, and then there were 2 major contrast reactions within my department. So knowing really what to do is really, really important. So always make sure your BLS training is up to date, and you make sure you've got your, you know, your local numbers, who to ring. Ask for airway crash team if it's a proper full-on anaphylaxis. So make sure you do know so what to do. So within CT, I found that mainly the patients are really generally unwell. A lot of them are cancer patients or on the end of life, and they try, even though, you know, we keep scanning them, we try to make them better, and then sort of provide more information for clinicians to make them better. Unfortunately, a lot of them will be unwell. And when patients are unwell, your scanning situation can change very quickly. So you have to be very mindful, particularly when you work with inpatients and your A&E as well. Sort of notice. We do also in CT in the use of interventional CT procedures like biopsies or nerve ablations, which are basically killing nerve, specifically for people with cancers that just cannot be cured. And there's so much in pain. These are high risk procedures because a lot of these nerves are very close to like large blood vessels. But in my hospital, we have a brilliant doctor that sort of does these nerve ablations, and it's just easing the pain. You might see some drains as well on the CT, some injections. And what I would suggest is just build your relationship with the interventional radiologist. You'll see them a lot. You will get to know the style, how they work. So my advice is just try to build a good relationship with your radiologist, because you'll be working with them sort of day-to-day basis. Within UK, we also do cannulation. Big way in different countries, you might not perform that. That might be more a role for job really for nurses or nursing sort of support. However, within image department, we have a role called image department assistant, and depends whether they are X-ray or in this case CT. They mainly work on the band 3 role, I believe, and they are trained to do cannulation. So that will be actually within specifically within the job description. So if you're thinking about applying, for example, for image department assistant role, in CT, it could be a good way of just getting your head around cannulation before you apply for CT jobs. It's just really an idea. But with the cannulation, so all radiographers must know the cannulation principles. If we have a patient coming from the ward without a cannula, we try not to send them back. We try to do the cannula and perform the examination, so we're not delaying the care. Again, data has come, so the reports have come through from clinicians that they were not happy because we couldn't perform a scan on time. So we're trying to prevent that by doing the things like cannulation, just doing the examination really. With the image department assistants, they help us a lot. Without them, we wouldn't be able to complete lists as it stands, how it's booked. And the only thing they can't do, they can't flush the cannulas. So they can sort of insert it, but any flushing to make sure that the cannula is working, that needs to be done by a radiographer. And normally within my departments, we have sort of different stages of who does that if things get complicated. So if the IDA cannot do the cannula for some reason, struggles, then the next step will be a radiographer that will step in. And then if we can't do anything, we are struggling with the cannulation, then we might ask a radiologist. If they can't cannulate, then we might ask for patient to come back and do the cannulation on the ultrasound with a specialist. Unfortunately, we had things like this happened before. There was just absolutely no access, and obviously outside of your upper limb, you are looking at lower limb cannulation to do the scan, but that needs to be agreed by radiologists and so organised especially for that. CT protocols, you just need to know your CT protocols, basically your basics. But again, these can be scanned, this can be found within your trust website. So all these informations, that will be made to you available. And the more you know, the more you'll know sort of on the job with time. You just need to give yourself time, but you just need to follow them. If there's any changes, always try to discuss it with radiologists, and then sometimes you have radiologists approaching you. Let's say someone before was asking me about aortic dissection and can we do CTPA at the same time. So by sort of increasing the amount of contrast, we were able to achieve everything. So there's always ways around it. So sometimes the radiologists, especially the registrars, which are training radiologists, they can come and ask you questions as well. So be mindful of that. Okay, so that's it from me. Thank you for your attendance. I hope you've enjoyed the webinar, and I'm here for any questions.
Thank you, Viola. That's as I said, that was amazing. That was full. That was really rich of really good knowledge and experience of yours. Please, dear guests, if you have any questions, there's a time to ask them now. Please use the chat. Please speak out loud. Use your microphones. However, we are limited with the time, so if there's gonna be no questions, we'll have to end the meeting soon.
Question, because she said about how many hours a week do you work or a month. So
my contract, okay.
My contract is 37.5 hours a week, which is roughly 162.5, I think, hours per month. Now, this can vary. I'll tell you honestly that it's not necessarily 37.5 hours a week. You might have a week where you do 40 something hours, and then you have a week where you do 20 something hours, because this is usually on a rota basis, unless you're employed Monday to Friday, 9 till 5. If you have that contract, that's fine. But if you are on a rotational contract with sort of rotate with the rota, then you might do more hours in certain weeks. And if you do on the certain month, if you do, let's say, more hours than you should have, then employer must really reimburse you for that, either give you some time off the next month in the future, or you get that paid as overtime, basically. Yeah.
Okay. Right, I don't know why. I'm sorry for that. I don't know why this question disappeared from my chat. Maybe it was a problem with connections for a second. Thank you.
I've got another question. What did the management do when the system went down, and how about PACS? So that's why the management's there for. So we had the processes. So in my hospital, we had to go back to paper. So we distributed paper requests to all the clinicians. In a way, we were able, from that paper request, we were able to create event on my computer system. Then that communication between the X-ray equipment at that time was available. However, we were not able to send these images to PACS because PACS was also down. So we had paper requests. So we're trying to obviously send the porter, get the patient, do the examination, and then the clinician would have to come to the viewing area to view this. And believe it, the incident lasted about 4 to 5 hours. It's a long time not to have PACS and IT systems down. But at the end of the day, we still continued. We were getting the images that were needed, and obviously it was a bit more work for clinicians to go in everywhere checking those. But we were still able to carry on. So at the end of the day, we had a big thank you from A&E consultants that we were still able to deliver the imaging as needed.
Do you have any more questions on your side, just in case if there is no transfer on my side?
I think we've covered.
Okay.
We've covered everything, to be
That's
honest.
grand. Right. So thank you for your attendance, for your for all your questions that brought so much value, I believe, to everybody. Because obviously sharing the experience, asking questions, is getting an answer, getting an answer is getting another experience. Viola, thank you for your time. Thank you for sharing your experience and knowledge, the insight of the radiographer profession in the UK. Thank you for highlighting all these obstacles, all this terminology, rules, and tips for everyone who want to join our NHS community or private sector here in the UK. What we have to remember from this webinar first is something that I think Joseph highlighted. It's not to give up and try again, because sometimes you may need 10, even 15 job applications to send and eventually be successful. Please contact us should you need any support. We are on Facebook, we are on Instagram. Here in Abram, we provide consultation with the HCPC process. We are reviewing and providing consultation during job application, mentoring and preparation for a job interview. This is Viola for radiography. This is Patrick and Vijay for physiotherapist. This is me for emergency medicine. Please stay with us on Instagram or Facebook website, where we share any interesting information, facts. Mostly Viola is the person who is responsible for that part in our team. She is responsible for our social media along with Zofia. Once again, thank you very much. Thank you, everyone. Wishing you a great rest of the day. Wishing you a good evening. And see you again on the next webinar that will announce via our social media. Thank you, Viola. Thank you, everyone.
Thank you, everyone, for attending. And yeah, I'm available on social media if you do have any more questions, or if you do need help and guidance with your applications and interview preparation, then I'm more than happy to help.